Doctors choose which anesthesia they use during surgery, not because it's just good for surgery itself, but because it could actually help with things like depression after surgery. So, this is a question that is brought up because of ketamine. So, we actually first used ketamine in anesthesia. Like, it was used for animal anesthesia and veterinary practices, and we use it in human anesthesia as well. And then, weirdly, scientists started noticing that, like, okay, hey, when we wake these animals up from surgery, like the next day, if we test them on a depressive measure, they are less depressed than animals who didn't undergo surgery. So, like, what was going on? They figured out that it was due to ket. And so we came up with this idea that ket would work well for depression. And we've since kind of expanded that view. So we've seen that it might help with things like pain, it might help with things like PTSD. So maybe it's not just anesthesia, but it could be used for a variety of things. Now, this has opened up this kind of weird paradox. Like, should we be using it for these other reasons? Or should we only be thinking about what is best for going under anesthesia? There's all sorts of reasons why people would want to use ket that's not just for anesthesia, but for other things like post-operative complications. So there have been a variety of studies where they've looked at hospitals who have started using ket for things like pain, hospitals who are trying it out to see if it helps with things like cognitive disruption, and they've had some kind of promising results. So here's the breakdown of what we found and what we haven't found. As a reminder, I am a PhD, not an MD, so if doctors want to come in here and start talking about this, please do. I would love your opinions on this. So anesthesiologists are basically allowed to choose whatever they think is best for the patient. And that's based on a variety of different things. Like, I'm not going to even try to attempt to explain how anesthesiologists do their job. But in general, it's like a variety of like, okay, how old are you? Do you have any other existing complications? Like, what things might be problematic for you during surgery? And how can we attempt to kind of like not have any of those things happen? Ket is just like one drug out of a list of potential different drugs that anesthesiologists could give to actually produce the general anesthesia required for surgery. Now here's the thing. The theory is that, like, if you're going to give something for anesthesia anyways, why not give something that could help with some of those other problems that appear? So some of like the post-operation depression that might occur, or maybe some of the like cognitive dysfunction. So we see that like when people undergo cardiac surgery, so typically older people who are having cardiac surgery, what happens is that 3/4 of them, when they're discharged from the hospital, are still showing symptoms of cognitive dysfunction, which means that they have problems with memory and problems with attention. That's a common problem during surgery, and one that ket might actually be able to help with. So they did this study where they had people either be given placebo or ket right before their kind of operation, while they were undergoing general anesthesia. And what they found was that there was less cognitive dysfunction in the people who were given ket versus the people who were given placebo. Now, it didn't fully help them. So they were not back to like the non-placebo, non-surgery controls. So they were still kind of impaired, but less impaired than somebody who wasn't given ket. Other studies have showed that it's helped with things like depression for breast cancer surgeries and maybe even pain. Now, pain is kind of a sketchy one because there are all sorts of mixed results here. So there are a couple studies that say like it did help with pain. So there are studies where they're looking at this hospital protocol. So they gave them ketamine not specifically for anesthesia, but here for pain. So after they got out of the surgery, gave a group of them ket. That was the new protocol that was allowed. What they found was that after people had been given ket, so after this protocol had kind of changed, there were fewer opioids actually taken after surgery. So it might have helped with pain. But there are other studies that show that like, no, it had zero effect. And there's one study that actually showed that ket given during the surgical procedure actually increased pain after the surgery. So even though it has some beneficial effects, it also has some problematic side effects too. So especially in older adults, it's been shown that ket might actually do things like cause hallucinations, and cause like vivid nightmares after they've taken it for anesthesia. There's been suggestions that it might actually increase confusion upon waking too, especially if it's a pretty short surgery. So as a reminder, ket is a dissociative hallucinogen. So people, if you wake up too early and you still have ket flowing through your system, you are probably dissociating. And yes, this is confusing when you wake up from surgery and you don't know where you are and don't actually even know what reality is. There are also a lot of worries about it being potentially neurotoxic, but that seems to be mostly in animal models, not in human models, so maybe not as much of a concern. And ket actually seems to increase heart rate and blood pressure in comparison to most of the other anesthetics, which seem to decrease heart rate. So that is a potential other issue that might occur during surgery. And like we do see that long-term chronic use could be problematic for ket. So we don't know what people are taking. We don't know what other drugs they're on. I mean, people lie all the time about what drugs they're taking, even before a general surgery where the anesthesiologist for sure needs to know. So there might be interactions with other drugs, but that's true of pretty much every type of anesthesia that you take. These studies kind of beg the question, when should you give people KET? Like, should anesthesiologists be thinking about the opportunity to use KET as an antidepressant while they're actually deciding which anesthesia to give during surgery? Should people be able to request that they're given KET during surgery? Like, I can imagine that this would be a headache for doctors. You're like, no, here is my protocol. I have specifically tuned it for you. And they're like, but please just give me a little KET. Then, like, trying to explain to people who are not anesthesiologists why this is not the proper drug for them, that would be a difficult and kind of annoying conversation to have all the time. Again, not a doctor, that type of doctor anyways, so please weigh in, doctors, in terms of what you think about this. But this is a question that is coming up far more often than you think, that you probably hadn't even potentially considered. Because now that we're using an anesthetic for things that are not anesthesia, these types of things are going to come up way more often.